I think that a lot of parents may not know that there are multiple ways to access us during this time and that we're still here and still able to help them. And I think they're doing a good job of it, but the concern would be that some things are being missed or some things are being overlooked that might be equally as dangerous or equally as concerning. So we'd like to try to make sure that they get in for the things they need to get in for in the safest way possible. There are some things that we can do over telemedicine, some things that we can't do. There are some things that we would be very strongly advocating, like vaccines, developmental things, follow-up of respiratory problems like asthma, some of the basic things that, we would not put off. But, if you have any questions about what can be put off, what, needs to be taken care of, just give us a call. The vaccine question is probably first and foremost. We don't want to have an epidemic of measles or pertussis or meningitis or a lot of the other common things that we immunize against. These are some pretty serious diseases, and COVID is something that we worry a lot about and become concerned about, but we don't want any of these diseases to happen on top of what's already going on. Beyond that, developmental things that we would be concerned about would be early forms of autism or developmental delays that would be responding to early therapy. The earlier, the better. If those were neglected for several months or even a year, that it could have dramatic impact on the future of the child. One of the first best steps is to try to hear what their concerns are, because it's easy to lecture and say we're doing this, that, and the other, but it's much more easy to listen and to say, well, we've heard that from many parents, or maybe that's something new and maybe we could adjust and become flexible and do things in a certain way to accommodate you and to alleviate any fears or anxiety that you might have. There are a lot of things that we can take care of, or at least triage by seeing the child and try to give them an idea. Is this something that's worth a visit, or is it something that is sort of emergent, urgent, or can be put off until a more appropriate time? If they do need to come into the office, there's a series of things that we try to do to eliminate as much of the risk of picking up the virus as we possibly can. The best time to come into the clinic is generally first thing in the morning, and the reason is because the clinic's been deep cleaned overnight. So there shouldn't be anybody who has the virus that's coming in the clinic. We've done the social distancing at the front desk to try to make sure you're at least 6 feet away, and we've talked about, if need be, having people have a virtual waiting room where you sit in the parking lot in your warm car and away from other folks, so you're not sitting in a waiting room. We try to adjust things and be as flexible as we can. But I guess the bottom line is that we're here. We'd love to talk to the parents. We'd love to help out in any way that we can.